the more leaders that you have and the more joint partners you can bring to the table, the further your ideas can go and the more that you can help the community. The Delta Grant has given us the opportunity to be able to realize that it's not just in hospital that we need to be helping our patients.
That's been one of my main goals, just to help everybody in the community reach their better health limit and do what we can do for them. We've had several months now where we've had no readmissions to our ER.
I had an elderly woman that would have anxiety attacks. She had no resources, she had no family, and she would call the ambulance and come to the emergency room every time she had a panic attack. Well, as I started working with her and she trusted me and she would call me, I can calm her down over the phone and talk her down out of that. So she's not been in the emergency room in over a year.
So it's been a drastic change, and I think mostly that is due to keeping in touch with the patient, giving them a resource that they can count on, and just letting them know that there's somebody here if they need them.
We are adding on mental health here in the hospital, and really that's kind of come from the Delta program with doing needs assessments and things. That's been a huge pull. Every time we had a meeting, mental health came to the surface as being something needed. And of course we've been through COVID lately, and there's been a lot of people that have been dealt a really bad hand because of it, and it just always came to the surface whenever we had a meeting. Mental health and transportation, those are two, because in small towns you can't have all of the services and resources that you have in a big city.
I am able to go out, and they trust me because they see me so often in the community and at the hospital, so they trust me to be able to tell me, hey, I don't have food, like where can I maybe get it? And so then I can go through my resources with them and tell them, what days of the week. And so they know the different dates that they could go pick up food.
The whole game is trying to keep people healthy. Our mission is to lead to a healthier tomorrow. That's our mission statement. And that's our goal. Through the help of the Delta, through the help of our programs here, we want to make sure that people are staying healthier and get them in early and getting that care they need with their lab tests, their mammography, their colonoscopies, any of that's going to keep them healthy. Will save expenses for the Medicare and the insurance industries, but it'll help us promote health and hopefully keep people healthy, and that's the end goal. Both our hospitals are in Perry County, Illinois. We both have the same social and economic issues, housing, transportation issues among some of them. And if we work together, we can help create a county that can address these better than one hospital trying to do it alone.
I've worked at the hospital for 19 years. I know the people, I know the residents, I know the joint partners. It's just, whenever I come to work, it's like I'm working with family. If it's the patients, their family. If it's my coworkers, their family. And just being here is just like a home away from home. The Delta team has been absolutely amazing throughout this whole process.
The Delta program has helped us evolve absolutely.
If other hospitals have the chance to take part in this, don't deny it. Take advantage of that. It's so amazing, and there's such great help.